Cast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. I'm Eric Lufer, the president of the Citizens Research Council of Michigan. It is my pleasure to welcome you to our panel discussion on youth mental health, the youth mental health crisis in school-based health services focused in the Midland area. If we can go to the next slide, Tim. Oops, back one. There we go. The Citizens Research Council is a statewide, nonpartisan public affairs research group. This is our 105th year of operation, a longevity we attribute to our promotion of sound public policy for state and local governments through accurate, independent, and objective research. We are a private, not-for-profit organization, and we rely on the charitable contributions of foundations, businesses, corporations, and individuals. I'd like to encourage all of you to learn more about us on our website, crcmich.org, and join our circle of supporters to help us continue to provide high-quality, independent information on important policy topics in Michigan. If you value how this webinar and the associated paper contribute to the public discourse and hope to keep the Citizens Research Council as an objective, independent, and credible source of information into the next century, please consider a contribution. Next slide, Tim. We'll be putting our recorded webinar and the slide deck on our website for anybody who wants to follow that. As I said, we're recording it. We'll post it. It takes an hour or so to process, so it should be up by mid-afternoon for anybody who wants to share it, share the recorded session with anybody that wasn't able to tune in. We have everybody on mute except for the presenters, so we'll not be able to hear you. On the GoToWebinar dialog box, there's a place to ask questions, and we welcome your questions. If anything needs clarification or you're having any problems, you can reach us at 734-542-8001. After the webinar, you'll receive an email soliciting your feedback, and we very much appreciate hearing from you. Children and adolescents in Michigan and throughout the United States are experiencing alarming increases in the prevalence of mental, emotional, and behavioral health conditions. Although mental health concerns have been rising at a rapid pace throughout the nation, while the nation contends with COVID, this trend, along with the underlying causes and risk factors, was underway long before the coronavirus pandemic began. A lot of attention is focused on how schools will be addressing their learning loss this year with students back in the buildings. I contend we need to think also about their mental health needs. Our new paper from the Citizens Research Council discusses the way schools are uniquely suited to assist youth with their mental health concerns. Youth spend most of their time within school buildings, providing a greater chance for the identification of mental health concerns and referral to treatment in this educational milieu than exists in any other conventional setting, such as a doctor's office, place of worship, or even their homes. As places centered around learning, schools are also the perfect vector to deliver information about mental health and teach skills that foster resilience. Because schools are also venues of socialization and psychological development, they are important venues for dismantling stigma and normalizing treatment-seeking behaviors. Today we're going to have Tim Mischling from the Citizens Research Council share the findings of our recent paper. Following that, we'll have a panel of some local experts to talk about the paper and some of the perspectives, some of the activities going on to address mental health needs in the Midland area. Briefly, Tim Mischling joined our staff in 2016 after working for several years as a legislative aide in the Michigan House of Representatives, as well as lecturing at Oakland University and the University of Michigan Flint. Tim earned a master's degree in public administration and public health and has graduate certificates in economic development and public health practice from Wayne State University. He's received a Bachelor of Arts degree in history from University of Michigan in Ann Arbor. And working with the Citizens Research Council, his primary focus is health policy. So with that, let me turn off my mic and camera and turn this over to Tim. Thank you.
Thanks so much, Eric, and thank you all for tuning in today. As Eric mentioned, in the United States and in Michigan, we're facing what could be characterized as a youth mental health epidemic. We've seen increasing cases of depression, anxiety, and a variety of other disorders for far more than a decade, and more than we would expect based on any normal trends or changes in diagnostic criteria or anything like that. These mental, emotional, and behavioral health disorders have become the most common illnesses that children under the age of 18 experience in the United States and in Michigan. 1 in 5 youth have a diagnosable mental health disorder, and this results in significant impairment for 1 in 10. And we see that maybe the silver lining to this is that now teens as well as parents are recognizing that this is a problem and seeing it among their peers. And as they say, identifying the problem as the first step to finding solutions and working towards solving it. As mentioned, this has been going on for a while. When we look at one diagnostic criteria, so major depressive episodes, we can see going back to 2008 until the most recent year for which data are available, there's a large spike in our 12 to 17-year-old population. Subsequent to that, as we might expect, because often mental health issues, when they're untreated, undiagnosed, or unmanaged, follow people into adulthood, 18 to 25-year-olds have had a subsequent spike, and so this is becoming a bigger problem within the population. And the preliminary evidence is still coming out for us to say just how much our experience with COVID-19 has exacerbated the situation or affected it. It's difficult to disentangle that. Certainly it's had an effect, but it's that piled on top of all sorts of other things. Nearly 1 in 5 youth in Michigan have been diagnosed with depression, anxiety, and/or ADHD. These are the most common behavioral health diagnoses, along with some behavioral disorders, defiance disorders that occur earlier in youth. We see this in our emergency rooms. We see it in anecdotal reports and from practitioners and calls to crisis lines, and in the hard data that we're collecting. So this in Michigan represents an 83% increase since 2007 in the number of major depressive episodes among youth. Unfortunately, while suicide can happen for many reasons, depression, anxiety, as well as substance use disorders all increase the risk for suicidal ideation and suicidal completion, and corresponding to the increase in mental and behavioral health disorders that we've seen in recent years, we've also seen an increase in the suicide rate among young adults and adolescents. And you can see that prior to the sort of economic collapse in 2007, 2008, Michigan was below the national average, and then subsequent, we've moved above the national average and continue to increase. And that's an alarming and sobering trend to look at. Suicide is now the second leading cause of death among young people, only after automobile accidents. Previously, homicide was number 2 and suicide was number 3. So I don't know if it's good or bad news. It's bad news all around, obviously, that homicides have gone down, but suicides have gone up. It's important to also note that when we look at the automobile fatalities, that depending on how things are classified, an automobile could be a mechanism that someone uses to commit suicide, and it may not be reported as such. substance abuse disorders, alcohol use in particular, as well as cannabis use, ADHD, depression, anxiety, all of these things increase the risk for automobile fatality as well. So we have a problem. What does it look like in terms of treatment? Well, there are numerous barriers. One of those being health professional shortage areas. And you can see from these data that roughly 40% of Michigan's population lives in an area designated as a health professional shortage area for mental health providers. So that obviously creates barriers to treatment for individuals. When we look at behavioral health providers on a county level, some of our counties do quite well. Washtenaw, Kalamazoo, Ingham, Grand Traverse, Kent. We see that these counties have within the 90th percentile of what we'd like to see in terms of the ratio of behavioral health providers to population, which is one provider for less than 270 people within those jurisdictions. Other parts of the area, including the Midland area and mid-Michigan and the Saginaw Bay area, in general, it falls around the average for the state. When we look at areas in more rural parts of the northeastern Lower Peninsula, the western UP, and southwest Michigan, we see severe provider shortages in those counties. For child and adolescent psychiatrists, the picture is maybe even worse. More than half the counties have no child or adolescent psychiatrists. In some cases, we'll see providers will go to an area and provide services maybe one day out of every couple weeks. Telehealth bridges some of this gap. You can see that Washtenaw County is the only county with a mostly sufficient supply, and through the University of Michigan, in some cases, psychiatrists can provide consultation remotely to other practitioners throughout the state, but this is a severe shortage, and there's no way to get around that. Access to providers isn't the only barrier to treatment. We also have to think about structural barriers. So for those areas of the upper peninsula, for instance, that have no child and adolescent psychiatrists, other rural parts of the state, to find a provider, there may be significant travel time. Insurance coverage can be an issue. People often cite not knowing what their insurance covers, not being able to pay for it. So there's a patient education and health literacy element to that. Waiting times are often an issue, and that does get back to the proportion of providers. And so often when someone finally hits a point when they're willing to seek treatment, they then run into, well, we can see you in a month, or we can see you in 2 months. In some cases, in that, it isn't helpful when someone's in a crisis. There are also a lot of social barriers. I mentioned some of the information deficits about insurance coverage, but general information deficits about when it is appropriate to seek treatment, how to identify when yourself or someone you care about, or a student in your school is experiencing a mental health condition that warrants attention. This is an area where we could use more education. We also have barriers created by our norms and values and the stigma placed on mental health, that people often feel that it's a sign of weakness to seek treatment. They're worried about what their neighbors will think, what their friends will think, the judgments placed on them, and that issues will follow them if they're documented in their medical records. And so this creates a substantial barrier, possibly and arguably more than any of the structural barriers or issues with access to providers. So as Eric mentioned in the introduction, one of the areas that we focused on for intervention is within the educational context and looking at school-based health and other school-based interventions to address these youth mental health conditions. it's fair to ask why we arrived at that conclusion. One of the plain reasons is that there's this bidirectional relationship between education and health that we know when we look at population levels that educational achievement is associated with lifelong health benefits and longer life expectancy. We know that there are social and intellectual aspects of development that happen in schools that influence health-related behaviors, like tobacco use, for instance, very low among college graduates, very high among people who didn't finish high school, or among people who completed a GED or alternative credential relative to high school graduates, and then again relative to college graduates, and even more so relative to people with graduate degrees. And it can be a tenfold difference, where I believe the last data I saw in Michigan was around 4% of people with graduate degrees smoke relative to around 40% of those who were not high school graduates. On the other side, student health impacts individual academic and later occupational success. And in a group setting, like our schools, a student's health doesn't only impact the individual, but it also impacts their peers in the school environment. This is certainly true of infectious disease, and we see issues with that moving forward in this school year, still dealing with COVID-19, and of course all of the other infectious diseases that have been with us longer, many vaccine preventable, some not. And this is true of behavioral health conditions as well, of depression, of anxiety, of behavioral issues within the classroom. And student health ultimately is also intertwined with discipline and attrition. And many of the kids who are classified as problem kids really are often children that have experienced substantial traumas, that have deficits in resources in their home, and this leads them to lash out or to have behaviors that maybe are not appropriate in a school environment, but absent treatment, this has fed the school to prison pipeline and has led to a lot of the issues with dropout that we see, which is subsequently tied to our rates of incarceration. But are schools equipped to deal with behavioral health conditions of students? Looking at the numbers, there's reason to question this with the way things are. When we look at some of our traditional health professionals that work within school settings, such as social workers, psychologists, and nurses, in addition to school counselors, we see that Michigan, in any of these cases, comes nowhere near the recommended ratio of health professionals to students within the schools. And this limits what can be done without addressing this issue. There's another approach to school-based health that I think is complementary, but doesn't get thought about as much, discussed as much, and is often overlooked, in that is school-based and school-linked health centers. So these are primary care providers generally that are co-located within a school building. These could be operated by a local public health department. They could be operated by the hospital system, or a federally qualified health center, an FQHC, in partnership with the school, and health providers, nurse practitioners, and others come to the school and provide treatment for students. This can include general primary care services, physicals for sports and other things, but also reproductive health, and certainly a variety of behavioral health treatments, most normally psychotherapy for individual students. In Michigan right now, there are around 200 of these centers, and you can see the density tends to be in Metro Detroit and in Metro Grand Rapids. And many other counties don't have any school-based or school-linked health centers. School-based health centers remove several of the barriers to access and treatment that we discussed. They eliminate the travel time, often through a variety of financing sources. They eliminate financial barriers to treatment, and by being within a school, they also normalize the behavior of going and seeking care when it's needed. And this is particularly important, as mentioned, for mental health conditions. The evidence that we have suggests that school-based health centers improve student health within the school systems that they're located in, and they also tend to see higher academic engagement and performance among schools with school-based health centers, comparing similar populations, and this is particularly true for populations that are at higher risk in vis-a-vis poverty and vis-a-vis the number of health conditions within the population. In addition to having, health professionals in the school that ideally could provide population level interventions, identify problems, and provide assistance to educators, staff, and administrators, and then having school-based health centers to provide access to primary care and mental health treatment. There are other strategies that we can think about. We really want to have multi-tiered support systems within schools, and I think this gets at the core of the problem in Michigan, that it's true in so many areas, but also true in behavioral health, that we focus on solving the problem when it becomes a crisis and providing treatment, but we don't invest very much in prevention. And so having a multi-tiered system that takes a public health approach to screening and providing support on a general level to all students, and then having increasing tiers of intervention based on student need is highly valuable. We have state standards for social and emotional learning, but these are not implemented in any way that's homogeneous throughout the state. Trauma-informed practices, as mentioned, are important in schools, particularly when we think about adverse childhood experiences. And looking at community models that provide family support and wraparound services to address other student needs, such as shelter, transportation, food insecurity. These are all things that improve both student performance as well as provide buffers against mental health conditions. And within the school environment, we also want to focus, of course, on preventing bullying, discrimination, and racism. When we look at disparities for mental health as a consequence of bullying, among other things, we see substantially high rates in the LGBTQ youth population, for instance. We also want to work to actively destigmatize behavioral health issues and make sure that students and parents and really entire communities understand that depression, anxiety, or other mental health issues are health issues just like cancer, diabetes, or any other conditions that we would commonly treat. And that because our body systems are interconnected, really these things work in tandem, and we have to address the whole person to make sure that they're healthy. And finally, evidence supports that school arts and music and other extracurricular activities can also be great vectors both for social emotional learning as well as fostering emotional intelligence and social emotional learning for students. And so when we think about the things that we invest in, I think the arts have to be part of the conversation, as well as sports and school nutrition, and really creating school environments that encourage people to be healthy and make healthy choices the easiest ones for students to make. And with that, I'll turn it back over to the panel for some reactions and some questions.
Thanks, Tim. I invite our other panelists to turn on their webcams and their microphones. And while they do that, let me just go around the table, the virtual table, if you will, get reaction to what Tim said from everyone and give them a chance to introduce themselves a little bit, some of their background. So let's go in alphabetical order. Stacy Berg is with Family and Children's Services in the Mid-Michigan area. Stacy, you work a lot with, sort of in this field of mental health. How does what Tim laid out jive with the world that you live in?
I think he's right on. We're seeing a lot of youth with anxiety. I think that's been the biggest issue, and they seem to be coming with some very heavy family issues, a lot of abuse, a lot of substance use of parents. So that makes the support at the school even more necessary. We also, social anxiety seems to be a big barrier to the students getting the support and stuff that they need, in this virtual world and in a world of texting and all of that. They're not learning the skills to be able to reach out to ask for help or connect with their peers or connect with adults because they don't know how to have those conversations. So that's been something we've tried to work on through our youth services program, and also the LGBTQ community too as well. We have a group for Compass that works with the teens, and that group is growing as well. So the teens want the support, they want the groups, they want to be able to express themselves. And so yeah, there has been a definite increase in anxiety, I think is the biggest one that we've seen.
Emily Lyons, let's turn to you. You're the Director of Innovation and Small Business and the manager of the Midland Area Farmers Market for the Michigan Business Alliance. How is the business community are they paying attention to these issues, and if so, how? If not, what can we do to raise awareness among the business community?
Oh, I would say the business community is definitely paying attention. If you think about it, our future talent is in school right now.
Yeah.
And we really care about how they are taken care of. Additionally, if the students are well supported, the parents feel more comfortable going to work knowing that their students are well supported. And then the entire family can flourish. And that's good for all of society. So it is important to make sure that things are taken care of at young ages. You can help, you can support, you can teach different ways to handle different things that come up. Because as Tim said, mental health it's the whole package. Mental, physical, we have to take care of all parts in order to make sure that, our neighbors and friends are thriving and flourishing.
So let's turn to our superintendent of the Midland ESA, John Searles. Your reaction to what Tim laid out and what you're seeing with the schools this year, hopefully staying open and having the kids in them, but a lot of stress for everyone, from the teachers to the students to the administrators, I assume. Your reaction?
Well, lots of stress right now for everybody, trying to figure out what the next move is in terms of COVID, right? And so that's been going on for a while now. I think that Tim's report is right on. And start with the premise, right? That schools are the right place to identify and to deliver services. I think that the report and Tim highlighted a number of the challenges that we have. One is first identifying kids that have mental health needs, and then figuring out how we're going to provide those services. In a climate where there's heightened anxiety, there is the threat, if you would, of COVID that we're all living under, and then the shortage of practitioners. The shortage of mental health practitioners is very real. And if you think about one of the things that we've been blessed with in schools in Michigan, or at least especially here in Midland County, is that the legislature has actually been paying attention to funding help for mental health under what we call 31N. So under the School Aid Act, there is the line item 31N, which basically provides all ISDs, all 56 ISDs in Michigan, about a little less than $500,000 a year. This is our third year, to really work toward addressing the mental health needs of our kids. So I want to just talk a little bit about that, because it's important for us to have in terms of context that $500,000 in Midland County to put toward the mental health needs of kids is a really big deal, because we're a medium-sized ISD or ESA with about 12,000 kids in the whole county that we serve. And the differences between like a Midland County and Oakland County, for example, or Wayne or Kent, is that they serve many more kids and they still get the same, more or less, $500,000. So as a state, we've begun to pay attention to needing to fund the mental health needs of our students in a different way, but we are funding it in a disparate way. Now, I'm not saying as a superintendent that I would like to share my pot of money or our pot of money with anybody else, but I do suggest that we work on legislative and budgetary issues together so that we can help fund in a more equitable way the mental health needs of kids in other counties. So for us, that is a real blessing, and one where we've made some really good inroads. Again, when Tim talked about some of the various aspects of providing mental health services for kids, in many ways it's cliche to say, well, we're building the airplane as we're flying it, but in many respects we are. We're trying to figure out new ways of identifying kids and screening kids for their mental health, and then trying to be able to provide on scale for kids' mental health needs. And those are all new things for us. You look at the data about the number of practitioners per student, and it's fairly dismal here in Michigan. But in the past, we have relied on our school counselors to provide for the well-being of kids. And in addition, we've asked them to do career counseling and a very long list of things. So now we're trying to really separate that and to be more aware of the well-being of our staff and students and try to approach it in a different way. So.
Let's talk a little bit about that. Midland, that Saginaw, Midland, Bay Area is a wonderful place. I love coming up and visiting, and but attracting talent is an issue, whether you're talking about doctors or school counselors or anything else. So what can be done to deal with it in your area? But it's sort of a statewide issue. If you're not in metropolitan Detroit or Grand Rapids, attracting talent in these ways is an issue. What can we do to find those people and make them aware of the opportunities in your schools?
I'll jump in on this one. So I think attracting talent is a problem across the nation, except for a few hot spots, right? We don't have all the amenities. We have different amenities. And so, from Boston, from Houston, from Boston, right? So we need to be able to consider homegrown talent and retraining and retaining that homegrown talent. I know you talked about education and health, and so, if we can keep the kids at CMU or SVSU or Northwood and bring them back, Mid-Michigan works with multiple of the schools that are offering MDs and DOs, and that's who we need to stay here so that we can continue to be at the top of the game. It is hard though, because we are seeing some really interesting things as far as birth rates and things like that. So we need to try and figure out, again, how we can say how great the area is, how great Michigan is. We do have a lot of water and things like that. So, you know, maybe it's just reconsidering, but there are a lot of great amenities that we have specifically in the Great Lakes Bay and especially in Midland County.
Maybe one of the best farmers markets in the Midwest, I'm just saying. But, you know, I like the question, because I think if we reframe it in like, in the sense of saying, what is it? I don't think there's one thing that we can do, right? This is about a whole community effort. And I'll mention a couple of things that I think are very impactful. And one is the whole well-being effort that we have in Midland County. We are very much focused on well-being and positive psychology as a pattern or a template or a model for us to live and work and raise our families. And so being very focused in our everyday life and our work aspects and our home life and all of those different parts of our lives, and being focused with our own well-being is a critical aspect to belonging and feeling part of a community and then wanting to stay there. So it's nice, like I would love it if it was 75 and sunny all year long in Midland, but you know, feeling like you belong to a community and that you're a valued member of that community is something that we have to work at together. And when people have that sense of belonging, they're more likely to stay, right? And we see that in some of the other research studies that, you know, Fargo, North Dakota, somewhere where, yeah, I think it snows and all the time, you know, is a very attractive place for some folks and businesses to do startups and all kinds of things. So it's not necessarily about the things that I might consider, but it is really about belonging. And so we have to work at thinking differently about how we grow our communities and how we meet the needs, whether they're mental health needs or medical needs or educational needs. And it is a challenge, but we need to think together about how do we attract and retain, and how do we grow? How do we grow our own talent? How do we take folks that are in entry-level positions in our communities or in our workplaces? For example, in my shop, you know, we have about 300 employees or so, and we have about half of those are what I would consider to be more entry-level employees. And some of them just absolutely have it, whatever that it is, for working with kids or as potentially future educators. And how do we help steer them into higher paying jobs where they can earn better money, where they can live and grow their roots here and not have to work multiple jobs, and meet the needs that we have, that we can project out. You know, we need more psychologists, or we need more physics teachers, or we need more social workers, or whatever it is. We can project that together, and then we can work to help grow those folks with partnerships with our local universities who prepare those kinds of certifications, like CMU and SVSU, that are right here, two great teacher prep universities right in the Great Lakes Bay region. And so, you know, I think there's a lot of aspects that we have to think about, and I think we were having some success in that area because we are, as a community, working together to think about the future and who we want to be 10 years, 20 years from now.
Stacy, one of the things that Tim talked about, recognition of ACEs, and training the teachers to be a resource to recognize and help kids get steered in the right direction to find help. To what extent are you working with the schools now to help them with some of these things, and what can be done to further that cause to help our teaching professionals understand the mental health needs of their students?
Yeah, we have therapists that actually go into the schools, both the elementary, the middle, and the high schools. And it's the counselors or the social workers there that would refer the students based upon whatever is needed through treatment. So to help the teachers, I think is probably education and awareness, and just knowing that we're available to be able to go in and provide those services. You know, we do provide some of them through our United Way. We provide them through some of the 31N money. So we've removed the financial barrier for the kids to access services. So I think it's being aware that we're there, we're available, we're ready to go, and letting the teachers know that.
Could I just say that one of the interesting statistics, and Stacy's absolutely right, the partnership with the schools is critical both for the identification and treatment. And I'm just looking at a report that I just filed. The number of students who received a therapy session in school in the past year was 1,641 in Midland County. And many of those services were provided by Stacy and her group at Family and Children's. So 1,641. Now that's important because if you were to look back 3 years ago, those individual therapy sessions during the school day was probably closer to somewhere around 0. All right. And that's not to say that there weren't things that were great going on in terms of partnerships with organizations like Family and Children's and Partners in Change and other private providers. But what's different is now that we have therapists, more qualified therapists in our school buildings on a daily basis, meeting those needs of kids. And so we're trying. It's not perfect, but it's a step in the right direction.
Tim, has any of this raised any thoughts with you? I want to keep you included in this conversation.
Yeah, of course. I would echo a lot of what all of our great panelists have already said. In terms of the 31N money that the superintendent mentioned, just to point out, our report looked at sufficiency of funds and the needs, particularly in larger counties, and we found you could double or even triple that, and we'd still probably have some unmet need just based on the level of shortage. In terms of strategies to recruit health professionals, I think the panel's been right on. Partnerships with higher education and with the business community are vital. I think as we raise awareness of mental health within schools, you may find more students who are inspired to pursue some of those occupations. But of course, within economics, we can also look at different kinds of incentives, whether that's loan forgiveness programs or scholarship programs targeted at specific disciplines where we have an express need. Those types of programs have been used for physicians, but it's certainly scalable and more affordable, really, to do that for social workers and psychologists and counselors. And I think homegrown talent is the key. That it's harder to convince maybe someone who grew up in Ann Arbor to move to Escanaba to practice if they have no connection to that community. But people love in general, and not always of course, but love where they grow up. They have family, they have friends, they have connections. And so when communities don't keep their homegrown talent, there's something wrong there, and we need to address those reasons why people are being drawn away, because it could be that they're being lured away by the siren song of these, hotspot cities like Austin or Boston or Seattle, but it could be that there are barriers within the community that even if they want to stay, they just can't make it because the salary isn't good enough, or things like childcare or other services within the community don't provide the support they need. I think the other recruitment strategy that's sort of parallel to that we see with primary care providers is that immigration can be a source of talent as well. And so we need to address both immigration policies, which is more of a national issue and outside of the scope of this conversation, or the Citizens Research Council's, state and local focus. But we can talk about attitudes toward immigration and how welcoming our communities are, and whether people want to come from other places to be part of that community. And that gets right back to the conversation we've already had about, the community building and really feeling like you have a place and you're part of something. And it sounds like Midland's doing great in that regard.
We have a couple questions that have been submitted by our audience. This one: have data been collected regarding the system's readiness for implementing a multi-tiered approach that is prevention-based? And there's another one. Let's address that one first. Are we prepared to implement a multi-tiered approach to really what Tim talked about, identifying, addressing needs upstream before it becomes a crisis?
I'll give a short answer of no. Sorry, not to cut others off. I mean, we can, I'm sure our panelists will turn this around and look at all the bright sides, but I think the lack of social workers and nurses inhibits that, because we have a lack of personnel to really look at those upstream factors. And our past Citizens Research Council research has also looked at how we've underfunded public health for decades. And so our community mental health and public health systems in the state both have some room for improvement, and that inhibits our readiness. That being said, I think it's heterogeneous, and the systems, at an ISD level or at an individual school building level even, are going to look different for every single community.
Yeah, and I think it's important to keep in mind that right now we are doing better than we have done in the past in terms of building those systems. We also have the danger, I think, of getting used to federal dollars flowing in because of the pandemic. Now, the 31N dollars are not related to any kind of federal dollars. Those are state dollars that are flowing. However, many of the school districts will receive a lot of those federal dollars that are pandemic related, and when those dollars eventually end, we'll be forced with making some choices that may include scaling back some of the choices that we've made available. And I'm not saying we as an ISD, but perhaps in the local districts across the state that folks have become accustomed to, that may be related to more of those things that we don't measure. All right, because remember that what gets measured gets done. And so we try to focus in schools on the testing aspect. And that's Michigan, like many states in the US, have taken that dramatic turn, 15 or 20 years ago, beginning with No Child Left Behind, to more of a testing and accountability rather than really trying to meet the individual needs and that social emotional learning that we're now trying to start talking about. Remember that educators are not prepared in school typically to meet the social emotional needs of kids. That's something new. We're learning about that. But again, it's not tested, right? We can look at data, we can look at studies, but it's not going to be on either the state or the national test, at least at this point. And so learning to measure the well-being of kids and communities is really important, and something that we're trying to do here in Midland. But I think that all of those, those aspects of those systems of support, the multi-tiered systems of support, are really important, and we might have them in many ways, but are they meeting the needs of all kids? No, probably not yet. And another aspect, as we begin spending more money in trying to meet the needs of kids, looking at, becoming trauma informed and then hopefully trauma competent in our schools, what we're finding is that we need to pay attention not only to the kids, but to the adults. So as we learn more about trauma in kids, it triggers traumas that the adults who are working with kids have lived through in their lives and perhaps haven't dealt with. And so that's an area that's pretty new for us also. And simultaneously, we're trying to build this system of support where we have to support the kids. That's our job. But we also have to support the adults who are supporting the kids. And that's kind of new for us. That feeds into the lack of practitioners and the fact that we haven't had a systematic way of helping our adults in schools talk through the things that they have seen, that they've had to deal with in the lives of kids.
We have a few questions about the 31N funding. One for John, can you talk about some of the ways that money is being used to address mental health? And related to that, what part of that money is focused on issues of students who are LGBTQ?
To the latter part of the question, I can't really answer that specifically. What I can answer is that the vast majority of the funds are for direct service to kids. And so some of the examples of things that are happening are family therapy. That might be family therapy occurring at school. And maybe Stacy, you can talk about some of those, like group therapy. But again, back to, it's really important to do screenings. And so screenings are paid for by the 31N grant dollars, and as well as the follow-up referrals, and then some of the therapies that are actually happening in schools, and then in a very seamless way to outside agencies. So Stacy mentioned, Family and Children's being partially funded by dollars from United Way, and I'm sure many other sources, but again, working hand in hand so that we might identify and then begin that process at school. Often it has to be handed off because there's more time or more systemic therapy that needs to happen. And so maybe you could answer that question better than me, Stacy.
Yeah, we're in our third year of providing, working with the schools to provide the services to the kids and the family. And I feel like each year we get a little bit better at providing the services and identifying the kids. And we do the individual, we do play therapy, we work with the families, any family therapy. We set treatment goals and work on them in conjunction with teachers or the social workers or the counselors. We do any community involvement that we need to with other organizations, maybe to get basic needs met or whatever. And we do connect with, again, like I said before, we have an LGBTQ group for both adults and teens that we can connect with that's free. So that's how we try to do the best that we can within the schools, but then also include the broader community as well, to get the needs met, because it takes a team to provide services sometimes.
So Stacy, the other, somebody else asked a different question that sort of flips this, looks at it from a different perspective. What do mental health workers like yourself want to see administrators like Mr. Searles doing in the schools and using the 31N funding on? What is being done that's working, and what changes do you think should be made?
Well, again, every year we get a little better and we learn a little bit more. I like the 31N money and being able to get into the schools because it removes a lot of barriers. There's, the transportation, the financial barriers, and again, being in the school and connected with teachers and things has gone very well in providing the services. And I would just say, to continue not having barriers put in place to inhibit the students receiving services. Providing space sometimes can be a challenge with confidentiality and privacy. So just continuing to provide good space for the counseling to happen.
Don't you think, Stacy, that this has been an opportunity, like you said, with just the presence of folks being in the schools it's really an opportunity to work toward the destigmatization of, recognizing that you have mental health issues that you need to address, and having folks around having easy access is certainly part of that, I think.
Oh, absolutely. And when there's downtime, the therapists are in all the classrooms and meeting the kids or eating lunch with them or playing on the playground or whatever, just to get their presence known. And they get all excited if they get to go, see their Miss Emily or Miss Jenna. And when other students see that excitement, then it spreads the word that, hey, it's okay. So that's been a really good thing too.
Question just came in. Can someone be referred to receive this counseling, or is the student only identified by teachers and/or staff?
That varies by school and their procedure. A couple schools have that tiered approach that you talked about, so it has to go before a committee before we get it, or a team. And then other ones can come from other schools are referred by the principal, or a parent may call and talk to the social worker or the counselor and get services for their kids.
I would say that, just like Stacy said, I would encourage you to call your school and ask, just kind of highlight it with whoever you get on the phone and say, these are some of my concerns. Is there someone that I could talk to about getting my kid some help?
Question was asked, how does COMPASS, I assume that's an acronym, COMPASS, interact with the school system to reach out to more students? And related are COMPASS meetings in schools?
So COMPASS is our LGBTQ group, and please excuse me, I can't remember what the whole acronym is. But so for the teens, it's connected. We're connected to the GSAs, and again, that's another acronym that I'm sorry, I'm not going to be able to tell you exactly what it is. But those are the student-led groups within the middle school and high school, so they're connected with our COMPASS groups. And then we also have, through the adults, we're partners with other LGBTQ, through the Dow Glad, through Perceptions and things like that.
All right. So, question that I can pose to Tim, and anybody else can weigh in on. To what extent is this type of education happening in the universities that the teachers are coming from? And if it's not, what can be done to address that?
Yeah, so it varies. I think more and more you're seeing schools of education or colleges of education at universities incorporating more behavioral health. That's true in nursing and in medicine as well, where this has long been neglected as this other thing that's not my job. So it's more and more, but not across the board universal, and in my opinion, maybe not enough. The report, and I would reiterate, it's important to recognize that educators are there to be teachers. They're not there to be mental health professionals, and we shouldn't think that teachers can replace trained psychologists or social workers, nor should they have to, because they have enough to deal with as educators. But I think that professional development needs to be provided, and that some awareness, and provided that there's support from other health professionals, can really make a teacher's job easier when they understand some of these issues and can speak the same language and work with mental health professionals. So there are a variety of programs that are out there that incorporate SEL and provide services. Trails to Wellness comes to mind from U of M. There are a number of different options, and I don't think that there's a single gold standard, nor do I think that the same approach is necessarily going to be the best fit for each school. So I would defer to other experts in the field to figure out the best way to do that.
Stacey, could you talk about youth mental health first aid a little bit, just what that is and how that's important?
I'm not familiar with the mental health first aid. I'm sorry.
All right, I didn't know if you offered that kind of training, but youth mental health first aid is a training that, Tim, I'm sure you're aware of, but it's a training for everybody, because one of the things that we know in school is that kids connect with different people. They may connect with a bus driver or a teacher or a cafeteria aide or anyone. And youth mental health first aid is a real basic training that helps people understand what to do and recognize some signs that kids are presenting with some kind of maybe trauma or mental health issue, and gives them the tools that they need to chat with the kid in an appropriate way, and then to make a referral to some other person, maybe a counselor or maybe a social worker or a psychologist in the school, just to really to build that whole community, like Stacey's referred to many times, about just how can we be better and more aware of one another and our well-being. And this is something that's new for many of us that are, I came up as an educator, right? And I had a number of child development and school psychology type of classes, but I'm not an expert in that area. And so is there a way, like through mental health youth first aid, to help people be able to connect and understand that when a kid says this, this is what you need to recognize, and then to maybe a sign that they need some additional help?
And that's a really important point that I was stumbling around, that it can't just be in teacher education programs, and why a professional development approach is valuable, because school staff can often be the person, like was mentioned, the cafeteria worker or a lunch person or other types of aides that a student connects with. And so really empowering every staff member in the school, not just the teachers, I think is valuable.
All right, let me this was more of a statement than a question, but let me put it out there and see if there's any reaction. Or Pam Singer says, we have started a pilot program, SEEK, that includes working with the medical providers to screen parents for childhood maltreatment risk factors and offer support such as therapy while removing the barriers of cost through a braided funding method. This collaborative effort uses resources available now, but behavioral health professionals is so important to this process for that soft handoff. It's a start, but it's an important start. Are you any of you aware of the SEEK and any reaction to that?
Well, I'm happy to dominate the conversation. Pam Singer is the CEO of Midland Kids First, and I happen to have the privilege of serving on that board. But, you know, the efforts of Midland Kids First, and particularly by probate judge Doreen Allen over the past, let's say, 15 years or so, have really affected, in a positive way, the numbers of kids that are being adjudicated. However, the area of maltreatment, especially the most young kids, birth to somewhere around age 2, those numbers have remained fairly steady over the past 15 years. And so really what we're looking at is trying to figure out other ways to help identify kids families who might be at risk of maltreatment. And so Pam has worked hard with others like Dr. Dick Dolinsky and a couple of pediatricians and OBs in town to really look at those patients that are coming in and do an evaluation to see if there's a potential for maltreatment, and if there is, to help intervene before there's a problem, intervene before, maybe even before the baby's born. And so we're really hopeful that a program like SEEK, as we collect data over the next few years, will be effective at helping to reduce those maltreatment numbers. So thanks for bringing that up, Pam.
Yeah, and I think the warm handoff approach it's an important point, and it gets to something that, you know, is tangential to this conversation, which is the importance of really integrating care so that we have healthcare teams that include mental health providers, so that there are connections, and we don't have to expect patients to go, to a physician and then to, a mental health provider in a completely different city. That we want to have those relationships where we can have a continuity of care from one provider to the next.
All right, so I think we need to wrap this up. I offer each of you an opportunity for any final thoughts, and to sort of prime that, would like to do more than just offer this one-time webinar. So what's needed for next steps? Are there issues out there that the Citizens Research Council can either take on or help to make people aware of what else needs to happen? Emily, we've had very few business questions, so let me turn to you first. Any final thoughts?
Sure, I would just reiterate that supporting employees and supporting their families through programs such as an EAP, which is an employer assistance program. I know the Midland Business Alliance offers that to us as employees, and we can just make a call over to Family and Children's Services and get a little help. But just those little things, and offering those benefits, and sometimes offering flexibility if you can really help. And it makes it more attractive to live in the area if you have community programs in place. And Midland has done a pretty great job at that in the last 5 to 10 years.
Stacy, any final thoughts?
I just would like to see us continue to work together to provide the services needed for our youth. It's good to see it made a priority and by everyone, and I hope that can continue.
Yeah, good. And John?
I think that maybe what the CRC can help with is on a statewide level to really think about, is there a way that we can legislate some kind of base funding like what we're receiving now, and then an additional per pupil allocation? And organizations like the social workers, the psychologists, professional organizations, and the school superintendents can help to come up with numbers like that. And I think it's really important that we don't take away from what we're trying to build for the 31N dollars specifically, because what we're receiving is very much adequate right now for Midland County and other counties our size and smaller. But we need to pay attention to the mental health needs of other communities without negatively affecting ours. And I think practitioners and building our own and those kinds of things are critically important. And so we'll need to continue to stay on this, beating the drum of how important mental health is and well-being is for all of our communities. And that's really on, creating that roadmap, I guess, toward what does it mean for each individual to thrive in their own life.
Tim, any final thoughts?
Yeah, I think following up on what was just said with 31N, looking at both population as well as need-based funding to augment that, so that all students are supported in the ways that they need to be in communities, is one step. But also recognizing that 31N is focused on providing direct care to students, which we have to do. When you look at the stats in our report, we have a need, we need to meet that need. The need, however, doesn't supplant the coexisting need for prevention. And just like our schools have, they have incentives to teach toward the test and to do things that are measurable. And since SEL isn't measurable, since music and arts aren't on the test, we've made some decisions that are maybe penny wise but pound foolish over the years, because that's what's incentivized, and that's what the system is is telling schools to do based on how our money flows and what is measured and evaluated. In the same way, we really need to have equal, if not greater, investment in community supports and preventions within community mental health. And that needs to be, separate money. That can't take away from meeting the treatment needs that we have now. But unfortunately, if you don't focus on prevention, you're going to have an ever escalating need for more social workers, more psychologists, more psych hospital beds, to a point where it's unsustainable. So you can't just look at the demand side. You need to look at supply as well, and really make sure that we're providing the supports early in life for students, so that we don't escalate to the need that we have now, and hopefully we can dial that down for future generations.
So I've not asked a few questions specific to counselors. The general sentiment of those questions is that our audience would like to see more counselors in the buildings. So take that to the powers that be and let them know that we need the funding, and people want those counselors. Let me thank our panelists, Stacy, Emily, and John. I really appreciate you taking the time today to be part of this, and for everything you do in your day jobs. Thank you, thank you, thank you. As I said, the session has been recorded. It'll be on our website sometime soon this afternoon. We will send out, or you can come to our website and find it. If you want to share it with others, easy enough to do. And that's it. So thank you all for your attendance today, and enjoy the rest of the day.
Thank you.